Hello, everybody, and welcome to Building a Natural Medicine Cabinet. My name is Lily Cunning. I'm the formulator for Haven Herbs, and this video is the educational component of our Natural Medicine Cabinet Starter Kit. So if you are watching this, you've either purchased the kit and come to this link through the collateral that we put in your kit, or you found this on YouTube and you're interested in building a natural medicine cabinet and maybe you would be interested in purchasing the kit for yourself. But at any rate, we want to go ahead and get started. So let's do that. Hold on just a moment. Whoops. Nope. Hello, everybody, and welcome to Building a Natural Medicine Cabinet. My name is Lily Cunning, and I'm the formulator for Haven Herbs. You either bought the Natural Medicine Cabinet Starter Kit and are watching this as the educational component of the kit, or you just discovered this video on YouTube and you may be interested in purchasing the kit after you watch this video. Either way, let's go ahead and get started. Here we go. Wonderful. All right. So today we're going to talk about what happens to be in U.S. Medicine cabinets for the most part. We're going to make some general assumptions that you are a typical American that has been taking pharmaceuticals, over the counter things to clear up common maladies that affect a lot of us, as well as buying your body care in big box stores, grocery stores, pharmacies, that sort of thing. All right, so let's get started. Um, First, I want to put out there that up until 1986, the vast majority of pharmaceuticals were sourced from botanicals. They were extracted, compounded, and then put into pill form or capsule form. Um, and it wasn't until 1986 that the shift happened where the majority of pharmaceuticals were synthetically sourced. And the reason the switch happened was not because synthetics are more effective, it's simply because they are cheaper. There was a higher profit margin to be had by synthesizing certain phytochemicals. And so that is what the pharmaceutical industry did. However, when you extract just a small percentage of phytochemicals from a plant and compound them, or you synthesize just those slim percentage of phytochemicals, you tend to create some side effects, which we have seen over and over again. And the other thing that I wanted to mention is that most remedies that you get from pharmaceuticals, whether it's over the counter or prescription, are just about symptom management, right? The diagnosis that is made in modern biochemical medicine tends to be a classification of symptoms, right? And they put a name on it, and then that name unlocks a prescription. And that's how it works. Well, symptom management does not necessarily get to the root cause of a problem, which means, much to the joy of the pharmaceutical industry, you're going to be taking that symptom management pill for a very long time, if not the rest of your life. The goal of herbalism is to help restore a healthy homeostasis, to get you back into balance so that you don't need to take things for the rest of your life. So, very different outlooks, very different outcomes, very different goals. So, if you're into that goal, switching to natural remedies, tonics, and body care as much as possible will actually help you on your journey. So let's talk about the number one thing that happens to be in American medicine cabinets, and those are NSAIDs, non-steroidal anti-inflammatory drugs. Now, this is brands like ibuprofen, which are Motrin, Advil, etc., acetaminophen, which is Tylenol, aspirin, made by so many different companies and generics, and naproxen sodium, like a leaf. Now, these drugs were never ever meant to be taken in the long term. And if you are taking NSAIDs daily or many times a week for managing pain or inflammation, you have an underlying problem that needs to be addressed. It is, again, symptom management only, but taking it frequently can cause damage to your digestive system, the liver, the stomach. It can cause just minor things like gas bloating. It can lead to heartburn, which could cascade into GERD, which cascades into esophageal cancer, nausea, vomiting, diarrhea, constipation, all the digestive heavy hitters, right? It also increases your chance for heart attack or stroke. That's not fun. And one of the less commonly known side effects is affecting your equilibrium, your sense of balance, your ability to proprioceptively figure out where you are in space. It leads to dizziness, lack of balance, difficulty concentrating. Um, so, what's the alternative to NSAIDs? Well, if you have pain, inflammation, fever, or cramping, there are many things that you can do holistically that will help you. Not just replacing the NSAIDs with an herbal supplement, although I will talk about that. Um, so you can try, depending on what symptoms you're trying to treat, essential oil roll-ons, right? There are some for muscle cramping. There are some for headaches. Haven makes a headache roll on that works really well. Herbal tinctures for pain and inflammation, like the one shown here, the gripes, which is basically just a replacement for ibuprofen or acetaminophen. You can also start doing daily tonics that help to reduce chronic systemic inflammation, like drinking golden milk. Golden milk is an Ayurvedic formula that it's golden from turmeric, and good formulas will include black pepper and some other warming, circulatory enhancing herbs to help get the turmeric around the body and make it more digestible. I personally put golden milk, I make a quart of it every week, and I use it as creamer in my coffee. Um, and that way, I know I'm getting it. I'm getting a regular dose. I don't have to take a pill. I don't personally take herbal supplements by pills, but you know what I'm saying? Like, I don't have to remember to take something else that's outside of my regular routine. I'm always going to have coffee in the morning. So, um, there's also salves, topical salves for sore muscles. You can also take a nice soak that includes herbs and minerals. There are herbal teas for myriad specialties. So, I make a headache tea, for example, or you can take a tea for anxiety. There's so many different kinds of herbal teas. You can even blend your own based on herbal knowledge that you have to address your specific symptoms. I also wanted to put a plug in for letting your fever happen. Fever is an immune system response designed to kill pathogens that have invaded your body. It heats up your body to a level of discomfort, right? That you can weather most of the time, but pathogens cannot. So the only time that you should start intervening in a fever is when it's 102 degrees for more than 3 days straight. You can reach 102 and then come back down in a day. That does not require intervention. You can have a fever for many days below 102, and that is not cause for intervention. When you intervene and start shutting down a fever as soon as you notice it, you are destroying your body's ability to kill those pathogens yourself. And you want your body to do its job, right? So, letting a fever happen within limits. There's my cats. Yay, cats. Move, move. Thank you. Um, Also, if you're having pain and inflammation, cold and heat therapy or alternating cold and heat therapy can really help those damaged muscles recover and ease pain. I just want to put out there that if you are going to supplement herbally for these things, botanicals tend to have fewer side effects in the body. And the reason is, as I mentioned, that um, pharmaceuticals that are even botanically sourced, they extract a certain level of constituents, not the whole plant. They compound those constituents. So, for example, you may have seen in the pharmacy curcumin. Curcumin is what Western medicine thinks is the active ingredient in turmeric, right? Um, but When you take too much curcumin on its own, the isolate, the isolated phytochemical, you are much more likely to get diarrhea, right? Whereas if you take the whole plant, turmeric, along with some other things that help make it more bioavailable, like black pepper, you are much less likely to suffer from diarrhea. Botanicals, when we use them, herbalists, we extract the whole plant, all of the phytochemicals, not just a small percentage. And that tends to mean fewer side effects in the body. My personal belief is that those other phytochemicals that aren't extracted help to buffer side effects in our body. But yeah, so those are some substitutes that you can make in your life for pain, inflammation, fever, and cramping. Another very typical thing that we have in American medicine cabinets is an antibiotic ointment like the brand shown here. Now, one thing you should know is that this antibiotic ointment or cream is in a base of petrochemicals, petroleum-based products, which are toxic to your body. You should not be applying that to your skin. And it often has some other toxic products in it too. So even the base without the antibiotics is problematic. But these antibiotics are ones that we have used for decades, and I would dare say we have overused them for decades, and we've even infused them into plastic cutting boards and changing tables. And what this has done is it has trained those bacteria that we used to be able to kill like that to be resistant to these particular antibiotics. So this kind of ointment contributes to antibiotic resistance, which in turn makes huge superbugs. We now have MRSA living in hospitals and patients who did not check in with MRSA leaving with MRSA. Um, they are just losing their effectiveness. So, what is an alternative? A topical salve, like a Boo Boo Balm. So Boo Boo Balm is in your kit, um, and it is for cuts and scrapes. It does not have any petrochemicals. It is botanical infused oils mixed with beeswax, which is medicinal in its own right. They do not contribute to antibiotic resistance, and it's super effective. Even people that have low reacting immune systems find that Boo Boo Balm really helps heal and fight pathogens really well. And Boo Boo Balm is a combination of things, right? So it's not just antibiotics, herbal antibiotics, it's also herbs that help heal soft tissue injuries. And so it heals quicker, it fights pathogens, and it's all natural. Another very common remedy that happens to be in US medicine cabinets are PPIs or proton pump inhibitors. These are for acid reflux, GERD, and there are some common brands listed here. I want to tell you that these were never studied for long term use and were never approved for long term use. And the reason is that long term use can damage your liver, it can reduce your bone density and increase your risk of fractures. It can lead to all kinds of bacterial infections, Colostrum difficile, pneumonia. It can give you diarrhea. It can also make you deficient in magnesium or vitamin B12, both very important for your body's functioning, give you chronic kidney disease, and even contribute or exacerbate dementia. Yeah. These are not drugs that you want to become dependent upon. And I realize that acid reflux is a problem, particularly if it manifests into GERD, which can lead to esophageal cancer. You want to stop that in its tracks. But if you are interested, you can always email me after this, and I can give you strategic lifestyle tips on weaning yourself off of PPIs. But my first number one recommendation is bitter, right? So Americans tend to avoid bitter flavors. In Europe, they drink bitter drinks in the afternoon. In Asia, they eat bitter foods, and other countries as well. Americans avoid bitter as a flavor. And frankly, we were evolved to eat bitter, and it is good for us. We have bitter receptors, not just on the tongue, but throughout the entire digestive tract. And when they are stimulated, they stimulate proper functioning. Digestive bitters, used as a tonic, is actually good for you. It stimulates those bitter receptors and actually gets your digestive system functioning optimally, which means proper um, release of enzymes and digestive acids and bile to dissolve fats. Um, and the more you take it, the more it benefits you because, again, you're tonifying your body by eating the things, consuming the things that your body actually requires. It requires bitter. Um, Now, digestive bitters is a two-part remedy, right? The bitters is the tonic. And I suggest that you take it 15 minutes before meals, at least twice a day, right? On the regular. And Haven makes two formulas of digestive bitters. We have the classic formula, which is a tincture. Tincture means alcohol extraction, alcohol and water. We also have a vinegar formula for those of you that cannot or do not want to consume alcohol. Both are very effective. Both have the same herbs for both the digestive and the bitter. Um, they just are in different solvents, right? To accommodate as many people as possible. The digestive part is the remedy, right? And often I will recommend people try digestive bitters after the season of overconsumption that starts with Thanksgiving and ends with winter feasting, right? So, if you have overconsumed and you feel uncomfortable and you've got gas and bloating, squirt some digestive bitters in there and it is gone very quickly. This is a tonic and a remedy both. Um, and it is super effective and fast. And I just want to put in a plug, when you strengthen your digestive system, you actually strengthen the immune, the endocrine, and the nervous systems because your digestive system is enervated. It has 75 to 90% of your immune and endocrine system in it. So you strengthen your digestion and you build digestive fire, as the Ayurvedics call it. You're going to be healthier, get sick less, have less hormonal fluctuations. It's going to be so much better for you. So, highly recommend digestive bitters in your medicine cabinet. And there's a lot there. Hmm. If you have digestive issues, and I will tell you that 25% of our primary care physician visits have to do with digestive problems. If you are one of those people, eating a healthy, varied diet, taking digestive bitters, and slowing down when you eat can do so much to improve your health, including your digestive health, but overall health. We live in a society that lets capitalism dictate when we eat, how long we have to eat, what we can eat, right? We have to zip through the drive through because we only have 15 more minutes on our lunch break, et cetera, et cetera. Um, it's not a good way to live. It takes its toll on our bodies. And if you can bring your lunch and maybe spend a week on meal prep, maybe on a Sunday afternoon, do some meal prep so that you can bring your lunch to work. It will go a long way to improving your digestive, immune, endocrine, and nervous system health. All right, let's talk about allergy meds because that's another common one that happens to be in medicine cabinets. Now, there's a couple different kinds of allergy meds. There's the take a pill kind or the dissolving film. And then there's also the sprays, right? Now, allergy medicines tend to have antihistamines and possibly decongestants in them. Often, if you see a hyphen D, that means it has a decongestant in it as well. And they also happen to stop itch if you have skin allergies. Um, but I want to recommend that you can switch so easily to herbal remedies for all different kinds of allergies and shut down that histamine response, which again is an immune system response. It is your body saying, there's this thing inside of us, whether it's pollution, pollen, dust mites, anything that you might be allergic to that isn't truly a pathogen. It's not a bacteria or a virus, but your body's going to react to it the same way, right? So it's going to create a lot of mucus to trap those things so that you can expel it either by swallowing it or blowing it out. It's going to cause itchy, watery eyes so that we can flush those particulates out. It's going to cause inflammation in the sinus passages, which causes sinus headaches and pressure, because inflammation is the body sending fighter cells to an area through the blood. It swells, right? Inflammation. And you don't necessarily want your immune system to stop having that response, because then it's not going to respond to pathogens the way you want. But stopping down a histamine response to normal things like tree or grass pollen can help you get through the day, right? So symptom management is super important. Um, I have all kinds of recommendations for you, for antihistamines, for decongestants, for itch relief. There are several different herbs here, and when you're looking for a formula, definitely keep an eye out for those particular herbs. Haven Herbs makes a fantastic allergy formula that is contains antihistamines and decongestants, and it's called Allergies. And I keep it on the regular, take it in the spring and the fall, because in the spring I got pollen and in the fall I got leaf mold. Those are things that really set my body off. But it works really quickly and it really is effective. So there are things that you can take. And I wanted to point out that those sprays um, are much worse for you than those pills. The sprays are steroids, right? Flonase, Nasacort, um, those are steroids, and steroids are not recommended for long-term use. It's just they're not. And if you're taking it every day throughout a season, you're disrupting your endocrine system by inserting external hormones. It's just not a good practice to have. So let's talk about body care, because a lot of people use their medicine cabinet, it's right there in the bathroom above the sink, and you got to brush your teeth, you got to get ready for your day. And there's so many different kinds of body care things that we tend to have in our medicine cabinet. So let's start on mouth care. Rather than toothpaste, I would highly recommend you switch to a tooth powder or tooth tablets. When you have a formula that includes liquids, um, you have to add all kinds of preservatives and shelf stabilizers and homogenizers, which are not good for you, into the formula in order to keep it shelf stable. And the toothpaste that you're getting off of the shelf is likely at least a year old, because it's manufactured, sent to the manufacturer's warehouse. That warehouse ships to a distributor's warehouse. That warehouse ships to the retailer's warehouse. That retailer sends it to the individual stores and it goes in the back. And then it gets rotated through. And eventually it makes it to the shelf and into your hands. Um, in order for something that is contains moisture not to mold and rot after a year, can you imagine the chemical shitstorm that is included? It's a lot, actually. And I know we haven't really thought about these things on the regular, but I want you to start thinking about these things because it's important. And your tooth powders, your tooth tablets should be in glass or metal or paperboard. Please do not buy body care products of any kind in plastic. And I know that is a tall order. Everything's in plastic, right? And yes, if you're shopping in a big box store for these kinds of products, everything's going to be in plastic. It is cheaper for these corporations to poison us with microplastics and poison the environment with microplastics than it is for them to package in glass or metal or paperboard. Some companies have made the switch, and that is great. But choose a company that, you know, does this on the regular. Deodorant. Oh, and mouthwash. We're still talking about mouth care. Mouthwash. Avoid Listerine. It's actually banned in some countries because it is implicated in mouth cancer. So you can either make an easy mouth rinse that kills pathogens and you can swish between teeth, or you can buy one. Haven makes one called Swish and Spit that is all natural and is approved by a dentist. When we were in Columbus, Ohio, um, I had an herbal student, and he was a dentist, and I had him try my entire mouth care line before I put it on the market. Swish and Spit is highly recommended. Um, so that's mouth care. Deodorant, again, uh, if it's packaged in plastic, don't use it. And look at labels. 99% of American body care contains parabens or fragrance. And if your formula says fragrance or parfum, which is the French word for fragrance, um, avoid it. Walk on by, because fragrance is considered a proprietary formula and they don't have to disclose what ingredients are in it. And companies know that we are now on the lookout for parabens. And so they just put it in their fragrance formula, and it's proprietary and they don't have to disclose it. Um, so buy a pit paste that is all natural. Buy a spray that is all natural and not aerosolized, right? There are so many alternatives that you can use for deodorant. And I know that some natural deodorants, either people find them ineffective or it gives you fire pits, right? Like it inflames and reddens. If you get fire pits, that means there's too much baking soda in that particular formula for you. It creates a scorched earth policy there, and just uh, upsets your skin. So switch to a different formula with less baking soda. I created our pit paste for people like that because there's still baking soda in it because that alters the pH of the skin and makes bacteria less likely to start regrowing after the initial killing of smelly bacteria happens with the application of pit paste, but it contains less baking soda than most formulas. It actually relies on probiotics to kill the bacteria more than it does baking soda. There are also fantastic probiotic body sprays that are all over body deodorants, but you can just use them in your pits, or you can use them in other parts that get hot and sweaty. And they do not contain parabens or fragrance. So definitely keep an eye out for those two ingredients. Lotion. So the lotion that you tend to buy in any store is contained in plastic, which, number one, microplastics. Just stay away from them, especially in lipid formulas like a lotion that contains oils and butters. Um, Plastics will leach right into that. Um, Haven makes a lotion, and you can see some of the lotions that we make below. Um, but we do it by pre-sale or subscription only. And the reason that we do that is so that we do not have to put toxins in the lotion, right? No shelf stabilizers, no. We use an emulsifier to bond the liquid to the lipids, which, works really well. But we do not put toxic preservatives in it, and we only ship it out in a month's supply. So every month, I am making lotions for our subscribers and our pre-sales, and then we ship it out immediately. And people do not have to toxify themselves with a nasty lotion anymore. Facial cleansers and treatments. You can exfoliate instead of buying like the plastic squeezy tube of exfoliant. You can create your own, either with grounded zuki beans or nut meals or, any number of things to exfoliate. You can use clay and powder some botanicals to make a face mask. You can buy the Haven Herbs facial line. Um, and we have serums and specialty treatments for aging or acne or rosacea. They exist, and there are companies out there that still package, if you still want a tube, my favorite metal tube is made by Dr. Hauschka. Dr. Hauschka is a biodynamic facial care, and the most amazing. It's super spendy, but I love it and it feels so good. Acne treatments. You can use spot treatments coupled with internal liver cleansing tinctures. I make a tincture called Skin Clear, which helps people with chronic systemic acne over a few months get all that out, because the skin is the last organ of elimination. You're going to see everything when the body is congested, when the liver is congested, it all comes out through the skin. So, using internal treatments for acne as well as topical treatments. Now, if you just get a pimple here and there, just use a topical because it's just a localized infection that you can treat locally. But there are so many ways to detoxify your medicine cabinet, including making your own, right? So if you're interested in some DIY, here are some places where you can get highly recommended, and I am not paid by any of these companies, um, but you can get highly recommended high quality products. So Mountain Rose herbs, you can see them in botanicals, butters, oils, and essential oils. High quality, they have a sustainability ethos. Everything's organic or ethically wildcrafted. Everything is effective and potent. I've never had a problem with Mountain Rose herbs, and they are good people. For essential oils, I also recommend Plant Therapy, which is a US company, very affordable, has a safety ethos because essential oils are corrosive, volatile chemicals, and you're only supposed to use a tiny amount. They will not steer you wrong about usage. You can also try Bulk Apothecary and Star West. And then if you are looking to figure out what is already in your house and if it's toxic or not, I highly recommend going to Environmental Working Group, ewg.org, or safecosmetics.org. They have databases and you can look up your brand or look up particular ingredients, and they will tell you exactly how toxic they are or are not. And if you're looking to, get some recipes, obviously there are books of herbal recipes that you can get. But if you're looking online, Herb Rally and the Mountain Rose Herbs blog have great recipes for you to try. So I highly recommend getting in there, rolling up your sleeves, getting your hands dirty, and making your own, because then you know exactly what is in that formula, right? My name is Lily Cunning. I am the formulator for Haven Herbs. We are the people's apothecary and your source for remedies, tonics, body care, and education. We have a ton of classes in addition to short videos like this that we produce for kids. And if you're interested in learning about herbalism or holistic health, I highly recommend you check us out online at havenherbs.com. Thanks so much for joining us for building a natural medicine cabinet. I look forward to answering your questions. If you have any, you can always email me, lily at havenherbs.com. Till next time.